Morning. It's a pleasure to be here. I appreciate the organizers inviting me. It's a special pleasure to be here on the panel with this group. My name's Paul Morley. I'm a veterinarian and an internal medicine specialist. I said that one time. I had to clarify I was a veterinary internal medicine specialist. Sorry about that. I have been working at Texas A&M for about a year now, and I formerly worked at Colorado State for about 20 years. And I've been asked to talk a little bit as part of this panel about, in the larger theme of, managing antimicrobial risk in humans, right, as it relates to applied veterinary medicine, veterinary sciences. And I've been asked to talk a little bit about what we know about use practices and their effect, our use practices in animals, and how those might affect health in people. So you're all aware that, as Don alluded to, that there's a lot of strong conceptions among society members about antibiotic use in animals. And some of the more common ones are, as Don mentions to start off with, that these exposures in animals lead to residues that they're exposed to in the food as well as in the environment. There's also a very strong impression that as we use antimicrobials in agriculture, that it's an excuse, that it's a marker for bad management, that antimicrobial use is actually a marker for mistreatment or poorly treated animals. And that when we treat these animals, that is clearly a strong driver for antimicrobial resistance, and that resistant bacteria that are created by this use, right? And I did say created in that strong sense, that there's a very clear pathway that these bacteria get into people either through the food or through the environment. And I personally believe that the press impression or the public statement impression is that there's a growing sense that these uses are an unacceptable risk, right? That this is an unacceptable thing. And that's led to a lot, as Don set me up without us talking about it, that this is really a strong motivator for the RWA, or Raised Without Antibiotic, movement in consumer choices. So many people, however, in society don't really understand, or I don't think they fully understand, the importance of antimicrobial drugs in terms of providing an abundant, safe, economically affordable food source, not only in our society, but the importance of that as we look at world populations. And we don't have just a static or decreasing risk or decreasing need for food. We actually have an increasing need for more abundant, safe food supplies. Estimates, you've heard the estimates for 2050 population of an increase of 3 billion people. The need has been projected that we need to double food production delivered to people globally, right? And that there's a mismatch between where food is produced in abundance and where it's going to be needed in greater abundance, right? And so places like North America that have a very efficient food production system will actually be depended upon for supplying a greater portion of the world population in our food supply. And as we face these instances, we still have hunger at our front doorstep. Right? The GAO says that 25% of children in the United States grow up in food insecure households. And 17% of children in the United States live in extreme food insecurity, right? Which means that they go hungry at least once a year. And that pisses me off. Sorry. But that really makes me mad. And it says that if we cannot just say it's okay to change our production practices and increase all costs for food supply without having an effect at home as well as globally, right? And so we have to increase more our food production, but there are all these competing interests and competing risks. There is not more land, right? There is not more water, right? We need to decrease our dependence on fossil fuels, right? Those kinds of things. And we have to do that as part of our agriculture production system. We have to do a better job of taking care of our animals and producing a safer food supply. So there's a lot of competing interests that affect this problem. So there's a lot of perspectives about antimicrobial resistance and as it relates to agriculture. But I'm a scientist, right? That's or at least I try to be, okay? I'm a scientist, and I was taught that in my discipline that I should be constantly challenging my ideas, right? That I should be constantly trying to disprove my hypotheses. That you only advance in your science if you are looking at what you hold to be true and you're continuing to try and disprove it. The stronger that a hypothesis is without being disproved, the more likely it is to be causal. Okay? So the underlying theme here in my work in the last couple decades has been, do we know that all uses of antimicrobial drugs are equally problematic regarding antimicrobial resistance? So I'm not a flat earther, okay? I'm not saying that antimicrobials do not lead to a selection of resistant populations of bacteria. I'm not saying that at all. But I do have a hypothesis that there are probably some drugs which are more dangerous when they expose different populations of bacteria in different animals, right? So if we can find those drugs which are efficacious for treating and preventing diseases and have a less strong pressure on promoting antimicrobial resistance, this is an important piece of information. This is an important piece of knowledge, not only for human medicine, but for veterinary medicine. And so that's my hypothesis, that all drug exposures are potentially not equally dangerous in terms of promoting resistance. So when we talk about this question, this hypothesis that I've put up here, does antimicrobial use in cattle, and that's my first segue in saying cattle. You're going to hear a lot about cattle as we talk about that. That's my little corner of where we live, and so I defer all chicken questions to Dawn up here, okay? Because I don't even eat chicken, Dawn. Sorry, okay? No offense, all right, okay? So a lot of my background and a lot of my perspective comes from cattle, and so please excuse that as we talk about this. But the question I have worked on most commonly is, does use in cattle lead to problems in human health? Now, the first thing is that we forget about, when we start talking about antimicrobial use, we often forget about the positive impacts of antimicrobial use and why we're using them. What is the reason for using them? Well, first of all, as Dawn mentioned, they promote animal health and welfare. And not only is this good for animals, it's good for our society. To have a society that takes care of animals is an important outcome. As well as the fact that if we have healthy animals, then we have a safer food supply, and we have a more abundant food supply, right? And it is a cheaper food supply, right? So there is a direct impact on food production amount, the cost, and its safety, right? And that may lead in an indirect way to reduced zoonosis exposure, right? And that's a more tenuous question and not fully proven out, but one that has been raised. Okay, but let's go to the negative impacts. But I did want to put the positive one up there. So we talked about the potentials that we have residues in the food and environment. We have very effective control systems in place for trying to ensure that we don't have residues enter into the food supply, as well as systems in place to detect residues. And we need to do a better job of telling the public about how effective and strong these systems are, that go all the way from the producer through to regulatory and marketing. Okay, we need to do a better job of addressing the question of, can we prevent more illness, right, so that we don't have this issue that we're covering for bad management. And that's about all I'm going to say on those two sides, right? And now let's talk a little bit about the questions about treatment leading to resistance. As a scientist, I put things on a whiteboard, and we try to pick apart, like, what is the question that we're asking, and how are we going to attack that? How are we going to attack that with different studies? And this is a diagram that I put on a whiteboard several decades ago. We worked on it, and it's this question, that the anthropogenic hypothesis of antimicrobial resistance. Anthropogenic meaning people caused, right? So in order for use in animals to lead to health problems in people caused by resistant bacteria, there are basically 4 compartments that have to happen. This has to happen for this to be true. First of all, we have to have antimicrobial use in animals. Right? Now that seems simple, but just because we find resistant bacteria in animals doesn't mean it's associated with treatment of the animals. We have to document that the treatment occurs. Okay? And then we have to find that use leads to a promotion of resistance, and we should be able to detect that, right? If it's a bad problem, if it's a strong effect, we should be able to find that. Okay? So this shouldn't be subtle. This should be something that should be measurable and with reasonable ease. And then maybe it's not just in the animals, it's also in the environment. Then those bacteria, we have to be able to track, or we should be able to track, that those bacteria go from the animals into people. And we can find those in the people, and we can show that it's the same bacteria. It's not just some resistant bacteria, it's a bacteria that we found that was resistant in the animals, and we can identify that it's been transferred into the people. All right? And then from there, we need to show that that resistance is not innocuous, right? That it is actually leading to health problems in people. Okay? So, to me, that seems fairly straightforward, that in order to do that in order to say that we have a problem from use causing resistance, that these steps should be documentable. But the problem is that many people would like us to say, so we know that antibiotics are used in animals. We document that. I'm a veterinarian. I've done it, right? I have helped put those antibiotics in animals. So we can document that the use is occurring. And then we know that there are resistant bacteria in people, right? And that those cause health problems. And we know that people eat animals, right? And so, and when we find resistance in animals, then there's been a lot of assumption that these have been tied together. And I would argue that we have not done enough work to try and tie those causal links together. And it's not that I don't believe that use leads to resistance, but it's important to dissect which uses lead to resistance. And it should be easy, right? If they are that dangerous is the question. Okay. So, what evidence do we have that use causes resistance? Okay, so this is I'm going to show you a bunch of graphs here, and I apologize because I'm going to try and dissect the themes as we go through, as opposed to the details of individual studies. If you want to ask me about that later, I'm happy to. This is some work where we've been using metagenomic sequencing, so we're looking at all of the resistance genes that we can find in a sample, right? The entire population of resistance genes, which we'll call the resistome. And these 4 bars, and I know that the text is small, but on the far left, that's cattle feces, and the second bar, that's chicken feces, and in the third bar, that's pig feces, and on the far right, that's treated human waste. Okay, that's human feces. And the pattern that I want you to see is that they're different. Right? The bar patterns are very different. And if we look in cattle, there's a great abundance of tetracycline relative to a lot of other resistance, followed by macrolides. In pigs, there's a lot more macrolides and less tetracycline. But we then see more aminoglycoside. Sorry, in chickens I was talking about. In humans, if we go to the far right, we see a greater abundance of beta-lactams. Well, beta-lactams are used a lot as a first treatment drug in people, particularly the cephalosporins. Right? And so these use patterns do sort of support the idea that use overall is associated with patterns of resistance overall. Okay? But that's not causally testing that hypothesis. When we look at that prior graph, we have to understand as well that resistance is not a new thing, and it didn't just pop up like a atomic mutation or nuclear mutation, right? Because antibiotics were used in these animals. This is a study that, as a science geek, right? It's one of those, dang, I wish I had done that, right? That is such a cool idea. And these scientists went to the Arctic Circle and they did core drilling into the permafrost and figured out that they were down into genetic material, metagenomic material that was at least 30,000 years old. Okay, and what they found when they started probing for antimicrobial resistance genes is they identified a diverse collection of genes for beta-lactams, tetracyclines, and glycopeptides. Right, glycopeptides. That's like vancomycin. That's a drug of last resort. They weren't using vancomycin, on the mammoths. Okay, so, and when they actually took those genes and cloned them into E. coli, they were functional. All right. So just showing that these genes are as ancient as the microbial populations, and just because we find resistance to modern day last resort drugs, that they were there, right? Now, did we select for them? that's another question. This is a little study. This is a study that we've been working on, sampling elk and bison in Yellowstone National Park and Rocky Mountain National Park. The 3 bars on the left are feces from elk and bison, and the 3 bars on the right are soil, right? And just again to point out that when we look in these pristine environments in animals that are wild and never been part of a treatment schedule or anything like that, we find resistance genes to things like tetracycline and glycopeptides, right, and beta-lactam. So we can find these in these kinds of animals. Okay, so going back to this idea of testing this hypothesis and what do we know about it, one of the first things that I looked at in my former role at Colorado State was that I was director of infection control. I was the ID doctor that was talked about in the hospital, right? And of course, I'm concerned about resistant nosocomial infections, and I want to know if our use practices in the hospital are leading to resistant infections. We know that nosocomial infections in general are more likely to be caused by resistant bacteria, right? And so the question that I had was whether or not we could see that just by coming into the hospital, were they being exposed to an environment where they would pick up a resistant infection. So we looked at this in horses. So this is again a type of figure that I'm going to show a couple times. And what you're going to see is a bar chart, and the categories on the x-axis are resistance to different drugs, and it doesn't really matter which drugs. We can talk about that if you want. But they're different drugs, and then the y-axis is the proportion of isolates that are resistant. And here we looked at E. coli isolates. We took feces and we cultured individual E. coli and we tested them for susceptibility in a diagnostic lab. And the 3 bars that what you can see there are for hospitalized horses on antibiotics, hospitalized horses not on antibiotics, and then we went to their farms and we tested those animals. And you can see that the animals that were in the hospital and treated antibiotics did have a higher prevalence of resistance, but so did the animals that had just come into the hospital, suggesting that they were picking up E. coli that were resistant just by coming and living in our environment for a short period of time. We repeated that study in dogs. This is not very many isolates. This is maybe 100 or a little over 100 isolates. And again, the same type of pattern that we see. So in an acute sense, acute exposures, we are seeing an increase in resistance. This is a study that was conducted by Guy Lonergan's research group, and they did an experimental exposure of feedlot cattle in small pens, and they were using ceftiofur, right, a long-acting ceftiofur preparation. And they had basically three groups: untreated cattle, cattle that were treated once, and cattle that were treated with 3 doses. And you can see in the top graph, and then what they have in this graph is they show the proportion of isolates that were resistant to 0, 1, 2, 3, 4, 5, 6, etc. So the more weight there are in the higher numbered bars means that they were more multiply resistant, right? Resistant to more drugs. And in general, what they found was that ceftiofur had a pretty profound effect on finding resistant E. coli isolates, and in fact finding more multi-drug resistant isolates. So in an acute sense, we have some evidence that says that they are shedding resistant bacteria. But Don mentioned generation interval, and the lifespan of a feedlot animal, or an animal that shows up on your plate as a beefsteak or as a hamburger, is more like 24 to 30 months at a minimum, right? And that's not even talking about whether it comes from a mature animal that's harvested at the end of their other production life career, right? So what we also wanted to do was to look at resistance in these populations over time. This is a study of feedlot cattle looked at longitudinally through their time in the feedlot at about an average of 250 days that they were on feed. Okay, so we sampled them early, middle, and late. And in this, they also had a hospital pen where they would take treated animals out of those populations and hold them. And the purple bar in the back here, you can see that those are much higher than the orange and yellow bars. And those are the hospital pen isolates. These are fecal samples picked up from the pen floor. And again, it shows that it suggests that acute treatment effect is there, that we do find more resistant isolates. And But when we look in the rest of the population in the pens, we see that that's quite a bit lower. So it doesn't look like it transmits back into the population. And if you think about the fact that cattle, if we're returning those cattle into those populations, and it might have an impact of transmission in there, we would expect the resistance in those pen populations to increase over time. But in fact, in this study, where we're looking at about 10,000 isolates, it's actually decreasing over time. So that doesn't fit our hypothesis as well. So then we did a study where, again, this is a study looking at about samples of about 10,000 fecal samples, right? And we looked at it was two treatment groups: cattle enrolled in a raised without antibiotic marketing program, and those that were raised for conventional product. Okay, so in those RWA production programs, if any animal is treated, they're taken out of that population, so they don't go back into that. And we found no difference in the prevalence of resistance across all of those antibiotics that we studied. Okay, we found no difference. This graph shows all of those isolates put together, right? And what I want you to notice is that there is this trend that we had a hypothesis for, right? That we've got increasing resistance over time in this population. In particular, that's very, very strong for tetracycline. Now, the problem with that, according to testing our hypothesis, is there's no tetracycline use in this feedlot. Okay? Here's another study. Now, these other ones where we looked at pen floor fecal samples, we're looking at the exposures in the group. And our question was, well, maybe we're not finding it because we're not actually looking at the treatment regimens for an individual animal. Maybe that fecal sample that we picked up doesn't represent what's being treated in the pen. So these cattle were actually randomized on enrollment to the project, right? So random selection of pens, random selection of animals within the pens, and then they were sampled throughout the feeding period. And this is a 4-year longitudinal study across 5 feedlots. And again, we had 10 to 15,000 isolates that we collected during the study. And what you can see is that there is this trend, again, with increasing resistance as time goes on in this population. It's most marked in tetracycline, but we do see it in other drugs. In this particular population, there was quite a bit of tetracycline use in terms of being included in feed for control of liver abscesses. Okay? And we did find a weak association with treatment with antimicrobials, the animal-defined doses, animal daily doses, being associated with an increased risk of finding an isolate of E. coli that was resistant to tetracycline. But it wasn't a very strong association. Okay, but we did find it in this population. Now, we also sampled a pathogen, right? Because while we have spent millions and millions of dollars around the world studying E. coli isolates, non-type specific E. coli isolates, I'm not aware of a study which actually shows that those isolates, the resistance in those is associated with a health problem or resistance in people, right? Or resistance in those isolates is associated with a health problem in animals, right? Not saying it's not valuable to study these over time, but it's an easy target, and so we have continued to target it. If we want to have an impact on cattle producers, we want to look at animal pathogens and try to understand that, not E. coli, right, which doesn't impact them. And I'm not talking about S-tex, I'm talking about generic E. coli here. So we tried to look at Mannheimia isolates, and the absence of the bars here is not that we didn't have any isolates, that's the prevalence of resistance. Right? It's just very, very low across the thousands of isolates that we looked at. And the point that I want to make here is that it was that the resistance in the E. coli was not predicted, did not predict resistance in the Mannheimia populations. Okay? So looking at that one bacteria did not help us as much as we thought it might. Now there are some other studies out there that have occurred more recently. I give you this as an example. This is a study that was done in stocker calves. So young cattle, 300 to 400 pounds, entering their first confinement and introduction to grain. And this is Brent Credile and Steve Gagier and Emily Snyder at the University of Georgia. And they have 2 sampling periods, and they basically they looked at the nasopharyngeal swabs of these calves at the time that they arrived at the stocker unit, so before they'd had anything done to them, and then about 12 days later after they had all received Tildapiricin. Tildapiricin is an advanced spectrum 14-ring macrolide with a broad spectrum. Okay, and what they found was not only that did they see more resistance, as you can see by the larger bar here, but they actually had more isolates. And it's led to a hypothesis that maybe the antimicrobial use is actually selecting and even promoting expansion, clonal expansion of resistant populations. And it's different now, right? And we are hearing that that's a question in feedlot producers. Amelia Woolhams at Mississippi State repeated that study and then found a similar finding. But it leads us to a question in my mind, right? So we look at one of the things that we say about antimicrobial drugs. It's not just that it impacts. I'm taking it for a cold, and therefore it only has a direct effect on the microbial population of my upper respiratory tract, right? That's what it's treating. No, it exposes all of the bacteria in our bodies and not just the pathogens, also the bystander bacteria. And as we focus on E. coli, right, from a few individuals, maybe we're missing the big picture about its background effect, right? And so I put this up here as an example. Morgan Scott, Guy Lonergan, Bo Norby at Texas A&M had a feedlot trial where they looked at chlortetracycline in the feed and ceftiofur treatment by injection, and they did a 2x2 factorial. And the first study, they collected samples longitudinally from these cattle. Excuse me. In the first study, what they did is they cultured E. coli like we talked about, right? And then they looked at it for resistance phenotypically, but then also probed for a couple resistance genes. Then they followed up on the bank samples of those, and they probed metagenomically. They didn't culture the E. coli. They looked at the PCR of the feces directly for those resistance genes. And then we followed up with a collaboration where we looked at metagenomically across all of the resistance genes. And what we found as far as the trends is not as important as the fact that all three studies of the same samples found different things, right? And the hypothesis that were formed and the findings that were found in looking at individual isolates was not supported by the PCR studies of feces nor the metagenomic studies of the feces. Right? So how we look at these things is very, very important, and we can't assume that just because we look at an individual isolate that it's telling us something about this. So this question of metaphylaxis or mass treatment of cattle that are high risk of respiratory disease is an important question with regard to feedlot populations. And so we did a study of another macrolide 14-member ring broad spectrum drug. I've got the trade name Draxin, but it's actually Tulathromycin, not Tildapiricin, so slightly different drug. And we looked at arrival versus day 11 after they've had metaphylaxis. Now this is a multidimensional plot, because when we start looking at, and our outcomes here are metagenomic sequencing, and so we have hundreds of different classes of antibiotic genes. We're just looking at the genes regardless of where they came from, and each one of the samples represents each one of the samples is represented by a dot, and it's taking information from all hundreds of those outcomes together. And basically the idea is the closer the dots are together, the more similar they are across all of those dimensions of resistance, right? And the more spread out they are, the less similar they are. And if you have two populations that overlap, they're similar, and if they're spread out, they're not. Okay. Bottom line from this study was that we did not find that treatment was a driver of difference in these populations, but that short period of time from over 11 days was actually the driver which was more likely to cause differences in these microbial populations. It wasn't the drug, it was the time. This is a study that we look specifically at that question, what happens over time, and we collected samples from populations at the time of arrival in the feedlot, at exit of the feedlot, on the truck when they were being transported to the slaughter facility, in the lairage where they were held before they went to slaughter, and then the products after slaughter. And I just want to show you this one graph where we're focusing on the resistance genes from arrival to exit of the feedlot, which again is like 250 or 280 days, right? It's a much longer time period than the broilers that we're talking about their lifespan. And what we see is a relative abundance. So the stronger the bars are to the left from 0 here, that's a log-fold change decrease, right? And if we see bars going to the right, that's a log-fold change increase from arrival to exit. And the important thing to see here is that across almost all of the classes of antibiotics and almost all of the types of samples that we had, feces, water, soil, there was a decrease over time in resistance, not an increase. Okay? Those were group level samples. These are individual samples. And what we find is again that the antibiotics that we used in the population. So this is the two blocks is that relative abundance of antimicrobial resistance. The blocks on the left then are arrival, and the blocks on the right are exit from the feedlot. Okay. And what we see here is that the red dots are arrival and the black dots are exit. And we see this separation of the resistome, right, lead a less resistant population across all of the bacteria through the time in the feedlot. And so we see time as an effect, but we did not find treatment in any of the about 15 ways that we tried to look at treatment. We did not find an association with resistome differences. Right. Now, the other part about this that I want to point out is that of all of the variation in resistance that we found in these samples, only about 2.5% of the variation was associated with this time effect. So while it's the strongest thing that we can find, it's still only describing a minority of resistance. Now, why aren't we finding that use, at least in our hands, and again, I'm not denying that use causes resistance. I'm just saying we've tried really hard to try and find those associations between use practices in cattle and resistance, and only the acute things that we're measuring seem like that's having an impact, and those don't seem to persist. Right? So why is that? I have to acknowledge that maybe that's an ecological timescale phenomenon, right? If it rains, on the curb, I don't expect to see that that it's eroded anything, right? And yet I can't deny, right, that the Grand Canyon is caused by an erosive pressure over eons, right? And so maybe we're not really looking in the time scale that we need to in order to find these changes, or maybe we don't have the right measurements in some way. But I think it's critical that we go back to this question, that we look at all of these blocks. If we really believe that use is causing resistance and it's affecting the health of people, it is an important question trying to understand where those ties are really strong. It's an important question, right? Very little's been done to look at outcomes in people or outcomes in food. We've started to do some of this. This is Kevin Thomas's master's project, where we did a convenient sample of ground beef bought in 6 cities across the United States. Okay, multiple package types, including RWA claims, raised without antibiotic claims, and conventional antibiotics, and then looking at the resistome. And we found no differences in the resistance profiles using metagenomic sequencing between those two studies. We're part of a collaborative group that is led by the scientists at Epix Analytics. It's a private risk analysis group that works in agriculture. Francisco Zagmuk, Celine Costard, Jane Povu are the lead scientists working on this, and they've been trying to do quantitative risk assessments using publicly available data about whether or not we can say that use is leading to harmful outcomes in people. And one of the studies that we have submitted relates to salmonella using publicly available FSIS as well as FoodNet data, right, about resistance, and then looking at publicly available data about beef consumption and use practices. And they're not finding an association between even though consumption patterns varied over time for beef meals, right, they're not seeing resistance in salmonella isolates that are associated with more beef meals, right, in salmonella isolates. If resistance was coming from beef, right, and salmonella was coming from those beef meals, right, and we were looking only at isolates that were beef attributed, right, then you would expect the more beef meals that they had to have a higher likelihood of a resistant outcome if resistance was a problem in beef. It's a bit indirect, right, but at this point, that's the types of data that we have. We have an ongoing study that we're working on right now with collaborators at Colorado State and Purdue University, where we're actually going to do a double-blinded feeding trial of people. Okay? So they enroll in this study, and you have to be willing to collect your own poop, okay? But we will give you all of your diet for 2 arms of a trial over 6 weeks. The first arm of the trial, you're fed diet, and it only has RWA claimed beef, right? So whole cut beef as well as ground beef. And in the second arm of the study, it has RWA claimed beef. And we're going to be looking at the resistome of the food as well as the resistome of the feces and trying to see specifically if we can see genes with specific SNPs that are being transferred into these people. Okay. So we're actively trying to study this hypothesis, but the basic conclusion, I told you a lot of things you probably are like, blah, 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 Morley, blah, blah, blah. Okay. But really it comes back to something that says that, you know, the truth about antimicrobial resistance is that it's extremely complicated, and we want simple. The society wants simple, right? And that's a real problem because we have to communicate a complex idea in a simplistic manner without making it overly simplistic. I'll throw one last slide up here, and it's not my study, but I just want to point this out, you know, that this idea of treatment, the antibiotics as a welfare idea, we have to struggle with that. We can't just pass it off and say it's only animals. You may have heard of the Mordor studies that were conducted in northern Africa, and this is originated out of some Gates-funded work where they were looking at chlamydial blindness, right, in trachoma, right, it's called. It's the most common infectious cause of blindness, and maybe the most common cause of blindness in Africa, and it's a big health problem. And what they had a question was whether or not if they did mass treatment of high-risk children, okay, with an antibiotic, would they see a reduced rate of trachoma, okay? And when they started looking at this, not only did they find, and the drug that they used was azithromycin. It's easy, right? So it's a Z-Pak, right? We get a Z-Pak, right? So they would do mass treatment across the community with azithromycin. And what they found was it was not just trachoma that was decreased, but it was all causes of mortality in children under the age of 6, right? All causes of mortality. And then they repeated in a multi-country community randomized trial, and they found up to double-digit decrease in childhood mortality, right? Now, mass treatment of high-risk individuals with a macrolide, okay, that's metaphylaxis in cattle. That's what we do, right? So that idea that there's a different, I mean, we have to struggle with these ideas about, is this wrong, right? Is this wrong on a stake of antimicrobial resistance? I mean, we have to struggle with those ideas, and I don't have an answer, but you know, I mean, all the things that Don said are exactly right. We need to use antibiotics less frequently. We have to realize that the public's not necessarily interested in the science answers. They're not interested in the science answers. They're voting with what they believe on another scale, and we have to deal with that. Treating sick animals is ethically required, but we also need to decrease the opportunities to treat those sick animals. That's, you know, and we need more research that really asks the question, what is the risk? What's causing the problem? This is a made-up scale graph, right? I think that there's equal concern about use of antimicrobials in animal populations and in human populations. I mean, people I work with, they're not pointing fingers. I think they think there's equal risk and there's equal concern. But if really honestly, there's far, far less funding to study antimicrobial resistance in animal populations. So if we think it's an equal risk, equal opportunity risk, we need to ensure that the funding agencies are able to look at this more aggressively in animal populations. So, and with that, thank you very much.